Now, Dr. Tapiwa Mungofa is the Treasurer General of the Zimbabwe Health Hospital Doctors Association. He now joins us via Skype from Harare in Zimbabwe. Dr. Mungofa, very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Very good evening to you.
Now, the fact that people or patients are now sent back to die at home is an indication that the situation really is dire and is at an alarming rate.
Yes, no doubt. The situation is critical, and it's now a cause for concern because nothing is being done to try and resolve this situation.
I mean, historically, Zimbabwe boasted a thriving hospital or health system in general. Whatever happened in the process? What happened to that?
I think it's actually the lack of correct governance and the lack of correct hospital leadership that's been going on. We have seen some equipment being dilapidated, being outdated without being replaced, which is something that we think should be urgently addressed. And also the fact that the welfare of the health workers, that is the nurses and doctors, people who are manning the hospital, is not being attended to with the urgency it deserves. Like you have correctly said, that current doctors, the junior, the middle-level doctors, they are earning a paltry salary of about $40, which is something on its own gives you a indication of how bad the situation is and how our government is failing to appreciate the essential services that are being provided by the doctors in the country.
Okay, do paint us a picture of, or if you can, of the situation on the ground, especially in the Zimbabwean health system. Is it because most hospitals or public health facilities are incapacitated or under-resourced, or does it have to do with the ongoing strike?
It's both. The hospitals themselves, they are incapacitated. They are inadequately resourced. This has been hastened by now the salaries of the doctors that have been eroded by inflation, causing the doctors to become incapacitated to report for duty. That is to say, most doctors are not able to report for work because they just can't afford to. But even if the doctors report for work, still the hospitals remain incapacitated, and the hospitals remain without the basic needs, the basic equipment for the basicest medical tests.
And I think those who suffer the most are the patients themselves. And I would imagine what a very painful experience that doctors like yourselves go through, telling patients that they should just go home and die.
Yes, indeed. The people who suffer the most are the suffering masses of our nation. Why? Because these are people who are not getting the essential health services that they're supposed to be getting. Of course, because the doctors are there when they need them to be there, and because there is no equipment, there's nothing really to help them. Also, the fact that the current environment has sort of like accelerated the current ongoing brain drain in our country. Doctors are now living for greener pastures. As you know, that doctors are on demand in other parts of the world. So most doctors are living for those areas where they are better remunerated, and of course living exposed and living the Zimbabwean population exposed. Because currently, even with the available doctors, the hospitals are severely understaffed, and we actually need more doctors, but we're actually having more doctors leaving the country. So the situation needs addressed urgently. It's an emergency, and just looking at the past 3 to 4 months, we have seen a lot of doctors leaving the country, of course, because of the eroded salaries And this has spread even to the senior doctors who are even leaving the hospital. So we now have hospitals operating in emergency mode, because now most senior doctors are not able to come to work, and some of them have actually left the areas where they are located.
So is the problem seen throughout the Zimbabwean healthcare system, or is it only confined to the public sector? What's the situation with the private sector then?
The private sector is of course, it's adequately staffed, but as you know, private hospitals are very expensive. And the situation in our country right now, it's affecting everyone. People do not have the money. All the civil servants in Zimbabwe, they are severely underpaid. And most Zimbabweans, to begin with, are unemployed. So most of our Zimbabwean population cannot afford private healthcare. And it's only confined to those elite who are less than 2% of our population. So the private sector, in as much as it thrives, it doesn't benefit the ordinary Zimbabwean citizen.
Dr. Bernard, share with us the status of the ongoing doctor strike.
I will correct you to say that it wasn't a strike. Doctors were simply conveying a message that the money they are getting is no longer enough for them to report for duty. That's why we called it incapacitation. But as it the ministry has failed to address to the doctors' concerns. I'm sorry for that interruption. The ministry has failed to address to doctors' concerns, and now the junior doctors, who are mostly back at work now, are now considering the fact that they only have 2 years of internship. So doctors are now funding themselves so that they can be able to complete internship and be able to leave the country, which is a situation that is not good for anyone. People being trained to leave the country is not good for the country. So we now call upon our ministry to now resolve the impasse with the agency it deserves, to now look into doctors' salaries and doctors' allowances so that they try and retain the little staff that they have.
Because I would imagine the only response coming from the government is the lack of funds, that the government does not have the capacity to accede to the doctors' demands. So what then would be the next course of action for the doctors?
In as much as we do not believe that the government cannot increase RTGS salaries for doctors, we now think that it is now time for the corporate world and for the private business entities, the non-governmental organization, the international community to now come and assist in the Zimbabwean healthcare delivery system. We want to extend our gratitude to the High Life Foundation, to Mr. Strive Masiwa for helping, for chipping in to help the doctors and give some form of funding that could help doctors to make ends meet. Of course, not all the doctors are benefiting, but we would like to extend our gratitude. We would also want to call upon other development partners, other business personnel in our country to try and do the best they could to try and assist doctors so that they can be able to report for duty without difficulty. We also call upon the same to try and find ways that they can assist our hospitals with the basic needs, with the equipment, with the sundries that are needed for day-to-day use, so that the health system doesn't collapse. Because right now, the health system in Zimbabwe is at a verge of collapse, and it needs to be urgently looked into.
All right, Dr. Mungofa, thank you so much for your time. Much appreciated. That was Dr. Tapiwa Mungofa. He is the Treasurer General of the Zimbabwe Hospital Doctors Association.